much now, just we've had enough delays. So I'm sorry about the fact that you're probably seeing all my slides as well as the main one, but let's just go through this. So what we're going to discuss today is the part 2 of the thyroid health, and we're going to discuss specifically Hashimoto's and a little bit of Graves. Now, wakey, computer. All right. So the primary difference between hypothyroidism and Hashimoto's or Graves is that Hashimoto's and Graves their trigger is an autoimmune disease. So what happens in an autoimmune condition is that the body's own immune system attacks itself. And they probably listed about 140 different autoimmune conditions, of which Hashimoto's and Graves are just 2 of them. But for example, psoriasis is an autoimmune condition, multiple sclerosis, rheumatoid arthritis. These are all, in fact, type 1 diabetes is also an autoimmune condition. So all of these are conditions that, depending on your genetic predisposition, what the triggering agent is, and intestinal permeability comes into all of them, will depend on where in your body that particular autoimmune disease is going to manifest. So for people who struggle with hashis or Graves, they have an autoimmune condition just the same as all the other autoimmune conditions, but in their particular body, their genetic predisposition is causing the body to attack the thyroid specifically. So now in autoimmune thyroid disease, really what's happening is that your B and T cells, which are immune cells, they become reactive to thyroid. We call them antigens, but basically let's just say components that make up thyroid health. And what happens is that the immune cells will then infiltrate into the thyroid and they produce antibodies that will attack the thyroid. Now, what is interesting with both hashis and Graves, but we're going to talk specifically about hashis at the moment, is that those antibodies can be present in the body 10 to 15 years before the patient actually gets a manifestation of the hypothyroidism. And that's why what I would recommend, especially for women, and especially women crossing the 50-year mark, but in fact, I'll qualify that, I'll even say 40. Every 5 years, it's worth having your thyroid antibodies checked, just to make sure that you don't have lurking in the background thyroid antibodies that are going to build up until your thyroid reaches such a state where your thyroid is broken down, and then we can't support it with whatever in other words, address the autoimmune condition. So what happens is that when they're testing to see whether or not you've got an autoimmune condition affecting the thyroid, they test there are 2 tests. One is your TPO, which measures your thyroid peroxidase, and your second one is your thyroglobulin. TPO is more common than thyroglobulin, but both of those are generally present in Hashimoto's. So the statistics show generally that about 95% of people who've got hashis have TPO, so thyroid peroxidase antibodies, and 80%, so I mean it's not much less, have the thyroglobulin antibodies. But I want to say here is it's important to actually trust your symptoms, because what happens, and those of you who joined us in the last lecture, what happens is that you get symptoms that are indicating low thyroid function. You go off to your doc. The routine test is to just test your TSH, and with the TSH then comes up normal, because if you're looking at 10 years before the manifestation happens, of course your TSH is going to be normal. And then your symptoms are dismissed and you're not treated in time before the thyroid actually starts to have sort of long-term damage. So in actual fact, in Hashimoto's, it's it's not a true thyroid disorder. And by that I mean the thyroid gland itself is not where the problem lies. Where the problem lies is in the autoimmune complex, in other words, the autoimmune condition. So the primary treatment when we're looking at Hashimoto's is, first of all, to address Hashimoto's as an autoimmune condition, and only on the back of that to address the thyroid problems. Because generally Hashimoto's, if you do not address the autoimmune condition first, you will not respond well to conventional treatment. And then, of course, you have this vicious cycle developing where you're just, you're like a hamster running on a wheel and you're not getting the benefit that you need. But look, obviously, from a functional medicine perspective, we look very much at working side by side with the patient, where the patient is taking responsibility for a lot of their own healing and a lot of their own particular conditions. So once one's checked, you then can have a look and see, okay, you're showing antibodies. What can you as the patient do, obviously under the guidance of your doctor or your functional medicine practitioners, or both preferably, what can you do to make sure that it doesn't develop into a big problem? And I suggest that every 5 years, it becomes like servicing our car, except we service our car once a year, not every 5 years. So it becomes like that, and it should be on the list of conditions or tests that one should do at least every 5 years. Now, if you've got any other autoimmune disorders, so for example, if you've got celiac disease, if you've got type 1 diabetes, basically any one of the listed ones, rheumatoid arthritis, MS, psoriasis, it's much more common if you've already got one autoimmune condition for you to develop another one. And thyroid is very, very common amongst women. So when you're looking at diagnosing hashis, generally when they're diagnosing, obviously blood tests are important, but they do a thyroid ultrasound to see what's going on with your thyroid. And then with the blood tests, you need to have a look at the antibodies. So you're looking at the TPO antibodies and you look at the TG antibodies. Both of those need to be tested. And as I said before, you want to test before the thyroid tissue has been damaged so much that you can't overcome or reverse the particular condition. Autoimmune conditions, people do ask me, can autoimmune conditions be reversed? What I would say on that is that maybe not to use the word reversed, is you can definitely put your autoimmune conditions into remission, where depending where you are on the autoimmune spectrum, if you catch it early enough, you can literally manage your autoimmune condition and live a completely normal life without even being aware that you've got an autoimmune condition. But this doesn't mean, when I say completely normal life, that you can eat and drink and do whatever it is that you think would be nice in your normal life, because with an autoimmune condition, there are triggers that one does need to make sure that these are addressed. So when you're having a look at your test values, the ones, I did actually look at all of these in the first lecture, but specifically one wants one's TPOs to be between 0 and 10. So let's say less than 10, and your thyroglobulin must be less than 1, really. So if they start creeping up, then one needs to address the autoimmune part of it. Now, what are the possible triggers? So the first thing we've mentioned is there is definitely a genetic predisposition towards developing autoimmune conditions. And unfortunately, we can't do much about changing our genes, but we can definitely manage whether or not those genes are expressed or whether or not those genes are hidden. And we can use nutritional and vitamins, minerals. All of these are helpful in keeping our genes hidden or allowing our genes to be expressed. And if you were to think about our genes as our arm in a sleeve, if one expresses the gene, it's like pulling the sleeve back. And if you want to hide the gene, it's like pulling the sleeve down. And as I said, certain things, certain nutritional support can hide certain genes. So, all right, the biggest one that one wants to address if you've got any autoimmune condition is to look at gluten and dairy, because there's a very, very strong link between autoimmune thyroid conditions, both hashis and Graves, and gluten intolerance. Now, there's a slight distinction between celiac, where there's a very, very strong allergic response to gluten, and gluten intolerance, because gluten intolerance very often slips in below the radar. And you can be gluten intolerant without necessarily being aware that you're gluten intolerant. But what happens is when the body's sensitive to gluten, it forms antibodies against the gluten. So, and antibodies, so immunoglobulins we call them. So immunoglobulins are present in your body all the time, specifically against gluten if you are sensitive to gluten. But if you want to have a look at being screened, screening for gluten intolerance, first of all, it's very expensive, and secondly, it isn't foolproof. And basically, why gluten intolerance is such a player in hashis is because the molecular structure of gliadin, now gliadin is a protein in gluten, and it basically gives the gluten, or gives the wheat, that stretchiness. You know, so when you're baking bread and you're basically molding all of your bread mixture, it's the gliadin and the gluten that actually gives it that stretchiness. But the molecular structure of gliadin is quite similar to the molecular structure within the thyroid glands. So when gliadin crosses the gut barrier, which I'm going to talk about now, the immune system is going to react to it, and of course it's going to search and destroy, and it reacts to the gliadin, and it reacts to anything that looks similar to the gliadin. So you get something called molecular mimicry, and dairy is a play in molecular mimicry, because in the protein, the casein, it's not the lactose. In the casein part of dairy, there's part of that peptide that looks similar to gluten. And the immune system doesn't know the difference. The immune system is just going to react to anything that looks similar. So when one's going off gluten or going off dairy to see whether you're sensitive to it, really what you've got to do is that you've got to go off it for at least 8 weeks, because it takes 21 days, so it takes approximately 3 to 4 weeks for those immunoglobulins to just halve in number. So if you don't expose the immune system, so you don't expose those immunoglobulins to gluten and dairy, they are going to start getting weaker and weaker and weaker. But 21 days, 3 weeks, it's still only half in number. So, and I have it so frequently with patients, I'll say to them, you know, you're going to go off gluten. And they say, well, you know what, I just once a week, I just have a small piece of pizza, or I have a tiny little biscotti with my coffee. And that tiny little biscotti, as tiny as it is going to bring up those immunoglobulins again. So 8 weeks is an absolute minimum to see whether or not you're off it. And I actually would say people who are suffering with any autoimmune condition, actually, but specifically with hashis or with Graves, gluten is just not on your list. You go off gluten and you stay off it, and that is the rest of your life. But it's not impossible to enjoy your life without gluten. Trust me, I've not been on gluten for, I don't know, it's about 5 years now, and I must be honest, I don't really miss it. So, and the reason why the tests are not accurate is because, let's say you decide, okay, I really love gluten and I've got hashis. So I want to see whether or not I'm sensitive to gluten. So off you go off and you have a gluten sensitivity test. But what happens in Hashimoto's, hashis is a Th1 dominant condition. Now, Th1, I won't get into it, but it's just an immune complex. We've got immune complexes. Th1 is an immune complex. Th2 is an immune complex. But what happens with hashis is that it's predominantly a Th1 immune complex, but the part of the body, the part of the immune system that's responsible for actually producing the antibodies to gluten is actually the Th2. But when you have a condition that's Th1 dominant, it suppresses Th2. So if Th2 is suppressed, then the antibodies are not being produced. So when you go for an antibody test to see whether or not you're sensitive to gluten, if, for example, your Th2 has been suppressed, then your Th2 is not producing the antibodies and you get a false negative. So it's better and probably more beneficial long term if you just go off gluten. Dairy as well if you've got an autoimmune condition. So for some people, just going off gluten is not sufficient. So I would suggest that if you've got hashis and you're not already off gluten, your first line is going to be going off gluten and dairy. If you find that after a couple of months of doing that, your antibodies are not going down, then you might be one of these people who need to go on a paleo diet. And a paleo diet basically is a diet that it has no grains in it. So corn, oats, rice, you can have vegetables and protein and good quality fats, but just not corn or oats or rice or any grains really. And also you're going to go off casein, so you're going to go off milk because of that issue with molecular mimicry, which I've spoken to you about now. Now, so there's the predisposition, so in other words, there's the genetic component, but then there are concurrent triggers that make certain people more sensitive to developing hashis. And the concurrent triggers are triggers like nutrient deficiencies. Now, we discussed nutrients in part 1 of the lecture, so I'm not really going to go through this in great detail now. I just want to mention that ferritin, so iron, for example, is one of them because TPO, so thyroid peroxidase, it needs iron to work properly. Sorry, spelling mistake there. Selenium as well is also another one that's very important. Adrenal fatigue, so if you're very stressed, that definitely makes any autoimmune condition, but hashis and Graves, it makes it worse. Food sensitivities we've pretty much discussed, so gluten, soy, and dairy. And to go on to an elimination diet, and there are structured elimination diets, so because for most of you, nutrition is not your industry. Nutrition is my industry or nutritionist industry. So there are structured elimination diets where one can guide the patient through exactly what to go off, what you can eat, what you can't. For my patients, I even give them recipes. So I've actually collected a whole lot of recipes that they can have, so they don't need to think about it. So you can just get on with life. The other thing are gut infections. In fact, the biggie is Yersinia. Yersinia is a big one. So testing for certain gut infections is important because Yersinia and hashis, the two very often go together. So if one has a Yersinia infection, it can kick one into a Hashi state. But the other common ones, H. pylori is quite a common one. Epstein-Barr, so Epstein-Barr is a viral infection, can kick one into a Hashi state. And of course, there are many others which I've not really mentioned here. The other thing to bear in mind is that when people have impaired ability to get rid of toxins, then that can also make autoimmune propensity that much more sensitive, so they can be more prone to it. And the gene SNPs that one would look at would be something like the MTHFR one or the GST ones. Now, if anybody's interested, I'm very happy to do a lecture on gene profiling, because gene profiling is actually becoming more and more prevalent in not only diagnosing particular conditions, but also in the management of conditions. Now, in South Africa, we've got 3 gene companies that will measure your gene SNPs, but I'm not going to go into too much detail with regard to that. We can always do that as a separate lecture if the demand is sufficient. As in terms of the infections, Yersinia, I mentioned, Candida is another one. So if one has thrush, that's another one that can be a trigger. SIBO, which is small intestinal bacterial overgrowth. And really what that means is that in our small intestines that shouldn't have too many bacteria, if you struggle with SIBO, you get a lot of gas, so a lot of bloating. So you eat something small and your stomach just swells up as though you're 6 months pregnant. And very often that's a SIBO condition. SIBO is quite difficult to treat, but there is a process that you can go through to address SIBO. The herpes, they can also trigger one into an autoimmune condition. Epstein-Barr I've already mentioned. Something like Lyme disease. Lyme disease is also, it's a real challenge to diagnose, and it's a challenge to treat as well. So sometimes, for example, if people are really not getting a good response with their specialist when they're treating hashis, one needs to just go a little bit below the surface and see exactly what's going on. Is it maybe some underlying infection? We don't check infections as a first-line treatment, and the reason why one doesn't is because these tests are extremely expensive. And it's mainly because in South Africa, they don't test these automatically. We actually have to send them to the UK, or sometimes even send them to Norway to actually get these tests done. So that's why they're very expensive. So again, there's almost a, I suppose, a priorities list that I start with, and you start with, sort of number one on the list. And it's only as time goes on and I find that the patient's not responding that we've actually got to go deeper to see whether or not we can uncover exactly why the patient's not responding to treatment. If you're removing parasites, I'm not going to go into this in great detail. I've touched on it here because it's sort of nice to have an overview, but it's far more complex than just this little list. Berberine actually is, if you suspect you have parasites, to go onto berberine or onto oregano oil. That's another one that's very good for getting rid of parasites. Now, what's not commonly known is the association between oxalates and hashi. Now, oxalates, basically, if you've got signs and symptoms in addition to your hashi, where you've got a lot of generalized inflammation, you've got joint pain, you've got interstitial cystitis, and you have this constant repetition of interstitial cystitis, if you've got leaky gut, if you find that you've got brain fog and depression, and a big one is kidney stones, then one can suspect an oxalate sensitivity. And basically what oxalates are, it's a compound that's found in certain foods. So certain foods are extremely high in oxalates. Now, it's very interesting sometimes because a lot of the foods that we believe are very, very healthy, like spinach and kale, so often I'll find that patients will go onto their spinach smoothie or their kale smoothie, and they believe that what they're doing is very good for the body. But because both spinach and kale, for example, are extremely high in oxalates, if these particular patients cannot clear the oxalates, then they get a lot of signs and symptoms, other symptoms that are directly related to their very healthy green smoothie drink that they're having in the morning. And then one has to get rid of the oxalates and go onto a low oxalate diet. The other thing with oxalates is that there is a genetic component to it as well, but there are gut bugs that are they're very effective at clearing oxalates. Now, for some people, even one course of antibiotics wipes out the gut bugs that clear oxalates. So, and that's why, again, one of the questions that I ask is, how frequently have you been on antibiotics? And for some people, they say, oh, no, not a lot at all, maybe only once a year. If it's at all possible, try and stay off antibiotics, because the impact on your gut bugs, even with something as uncommon, I shouldn't say it's so uncommon because it actually is quite common, but not well known really as oxalates, can, that if that gut bug has been wiped out, now you become sensitive to oxalates. And, who would have thought that your smoothies or your green drinks are in actual fact detrimental to your health? So what would be the treatment approach? So the first one, which I've mentioned, is to eliminate gluten. And if you just Google and you go into gluten and autoimmune conditions, or gluten and hashis, or gluten and Graves, you will see there are many, many citations that link gluten with autoimmune conditions. So intestinal permeability is made worse by gluten, because what happens, now let me just go into intestinal permeability a little bit. In our gut, what separates our gut, in other words, what's inside the gut, which is basically our food, our digested or partially digested food and our gut bugs. What separates that from the blood supply that runs next to the gut is basically only 1 cell thick. It's tiny and it's very, very fragile. So with gluten, what happens with gluten? Gluten does 2 things. First of all, the body doesn't digest gluten very well, so it acts like a pot scourer. It basically scrubs all of that lovely mucous membrane that we have lining the inside of the gut that protects that little 1 cell thick. It's supposed to be a very tight junction. If we have gluten, it scrubs off our lovely mucous membrane. But the other thing that gluten does, gluten stimulates something called zonulin. And zonulin is actually contained, our body secretes zonulin, but we don't want too much zonulin, because what zonulin does is it opens the gut junctions. So normally our gut junctions should be really tight. Zonulin basically opens those gut junctions. And what happens then is when the gut junctions are open, what is sitting on the inside of the gut leaks across into the gut-associated lymphoid tissue. We call it GALT, gut-associated lymphoid tissue. And it's basically the immune system that lies next to the gut. And the blood supply there, so picks up on the gut bugs and the foreign objects, because the body is not designed to have partially digested food in our blood supply. So our immune system takes one look and thinks, what on earth is that? And the immune system goes up and our inflammatory process goes up. So if you have intestinal permeability because you are sensitive to gluten, you've got this constant flow of molecules from the gut and gut bugs actually from the gut into the bloodstream that stimulates the immune system. And that's why with any autoimmune condition where the immune system is overactive, intestinal permeability is the first thing that we need to treat. We need to close those gut junctions. So when you're looking at healing the gut, probiotics are fantastic. So if you're on a probiotic, just have a look at the back of your probiotic. You know, one of the ones that we get, I think it's called 8 strain. It's got 10 million gut bugs in it. Now, if you have a look, to get enough probiotics, we want something along the lines of 50 billion, between 25 and 50 billion CFUs in our little pill. So 10 million, really, I mean, it's a drop in the ocean. It hardly works at all. You can get your gut bugs from fermented foods, so something like kefir and kombucha, fermented veggies. The other thing that heals the gut very nicely is zinc. So L-glutamine is another one. But if you're going to go onto healing the gut and you're looking at probiotics, one does need to watch out for a gene SNP called DAO. DAO, it's an enzyme. It's called diamine oxidase. And diamine oxidase helps the body to clear histamines. Now, probiotics are very high in histamine. So if, for example, you find that when you have probiotics, you tend to get a bit nasal, you get sinus problems, or you get flu-like symptoms, you might be somebody who's got a gene SNP in DAO, and then one has to approach your healing, your gut healing from another direction. So you can see just so far how multifaceted it is when you're looking at any autoimmune conditions, because there's so many things one needs to consider if you want to address a particular condition. And that's why generally, you know, with a specialist, they look at it from a linear perspective. So they'll look at treating it conventionally, but they don't address healing the gut. They don't address the issues with zonulin. They don't necessarily change your diet. And yet, if you don't do these as a foundation, as I said before, the conventional treatment just doesn't work properly. So when you're looking at elimination diet, because one needs to see what are the triggers in your body, because everybody's different. Some people may be able to cope fine with dairy, some people not. So when you're looking at elimination diet, what we do is we take out all the foods that can trigger a response. So you see the list can be quite long. You know, gluten and dairy are biggies. Soy, Processed food, only because we don't know what's in processed food most of the time. Grains, if you're unlucky. Eggs, certain people are allergic to eggs. Nuts, legumes, nightshades. So if, for example, you get a lot of joint problems, you've got pain, you might be sensitive to nightshades. And in actual fact, somebody did ask me a question about ashwagandha and whether or not, what is the issue with ashwagandha and hashis? Now, ashwagandha, first of all, is a nightshade. So if people are sensitive to nightshades, they can't have ashwagandha. The other thing with ashwagandha is it slightly stimulates the immune system. And if you're looking at an autoimmune condition where your immune system is already reactive, then to go on something like ashwagandha, maybe it might just stimulate your immune system more than you need and give you a hashi flare. And it might be better if you go off that. Generally, I love ashwagandha because ashwagandha is so good in dealing with stress. And because stress and autoimmune conditions, they tend to go together as well. In general, I love ashwagandha, but one just has to be aware that some people can't take it. So if you're looking in general at a treatment plan, a good treatment plan to start with would be, if you really want to go for it, you go on a paleo diet, which is, you've got no grains at all, and you're going to do that for at least 2 months. You're going to go on to vitamin D, selenium, your B vitamins and your vitamin C. These are the basic vitamin support that your thyroid needs generally for good thyroid health. And you can look at part 1 of the thyroid lectures if you want to just go into that in a little bit more detail. You need to address your stress. So one needs to look at adrenal support, and it depends on where you are in terms of the stress response as to what type of adrenal support one needs. So for me, if I'm addressing adrenal support with a patient, I don't bother looking at the first thing in the morning blood test adrenaline. I think it's an absolute complete waste of money. I look at the 4 times in one day salivary adrenaline support, so salivary cortisol. And I beg your pardon, it's actually, cortisol first thing in the morning, not adrenaline. But I look at the 4 times in one day salivary cortisol, and then I can see exactly where the patient is in terms of their cortisol response or their stress response. And depending on where you are will depend on what type of treatment that I will use for the adrenal support. Very often one needs some type of a parasite protocol, and one needs to be on that for about 2 months. And you need to support the gut integrity, so heal those gut junctions. That is absolutely foundational in addressing hashis. Now, this was something that's very interesting. People who've got big flare-ups with hashis, and I don't know how many people have actually used enzymes to address the immune complexes. Basically, enzymes, and they're normal digestive enzymes, but you don't take them to digest food. You actually take them in between eating on an empty tummy, because normal digestive enzymes clean up the immune complexes. So when your immune system's going absolutely haywire and crazy, and you've got immune complexes all over the place, digestive enzymes will help to eliminate those immune complexes. So you take them between meals on an empty stomach. And they are things like bromelain, the ones from pawpaw, the piggy ones, and the pancreatine. All of these are enzymes that will help to clean up the immune complexes. The only caveat here is the dosage is quite high. So you're looking at between 5 and 10 capsules 3 times a day in about a glass of water. So it can get quite expensive, but usually one would recommend this if you're having a flare. And then once the flare is controlled, you can basically settle and you can go on 6 caps a day in 2 divided doses. So for example, 3 empty tummy in the morning and 3 empty tummy in the afternoon. Or in fact, you can even take 6 at one sitting. Again, just make sure that your stomach is really empty. Now, the other one that's not really addressed in hashis is thiamine. Now, if the side effects that you're getting with your autoimmune disease, so with hashis, is exhaustion, thiamine is fantastic for that, because it does help. It's actually, if you go into the benefits of thiamine, they are countless, but it supports the fatigue. It also helps your body just to produce a bit of stomach acid, which you need. And it's very good in carbohydrate sensitivity. So in actual fact, we give thiamine to alcoholics because there's a condition in alcoholics called soggy brain. Have you ever thought of this name? But anyway, called soggy brain. And soggy brain basically is a result of a vitamin B1, which is thiamine insufficiency. So if you are somebody who tends to eat a lot of carbohydrates, or you tend to be a little bit too generous on the alcohol, go onto a thiamine supplement. If you look at the vitamin B complexes, you'll see the amount of thiamine is so tiny that I don't even know why they bother to put it in. It's so tiny. One would need to go on, if you are addressing a thiamine deficiency, one needs to go on something along the lines of 600 milligrams to 1,200 milligrams. People, by the way, who have restless leg syndrome, thiamine can help restless leg syndrome if you're looking at the between 600 and 1,200 milligrams. So, and then you can maintain on about 100 milligrams of thiamine. So one does need to get it in a sort of a separate source. And Willow, I think, has got a very nice brand. Just trying to think if there are any other ones. But yeah, if you go to a health shop, you just look on the health shop and you'll be able to look on the back, and you need a minimum of 100 milligrams of thiamine. Then if you're going into the more specialized treatments, these you would work with your specialist to try and address the thyroid issues. Because with hashis, you get hypothyroid signs and symptoms. So one of the ways is to go on desiccated thyroid, but some desiccated thyroid products have actually got thyroglobulin and thyroid peroxidase in them. And this can exacerbate the hashis, because the more TPO, for example, you've got, or the more thyroglobulin you've got, the more your immune system will make immune complexes to attack those. So in situations like that, you have it compounded. So you do a compounded T4 and T3. That's an option, but these have to be specially compounded at a compounding pharmacy. They're not something that one can actually just buy off the shelf. They are more expensive, but it's one of those things. I know when you've got systemic conditions like hashis, you just know, you're going to end up, paying more. Selenium would be a supplement that you would take. Selenium is very accessible. You need to be on between 200 and 400 micrograms of selenium. Don't take more than 400 micrograms of selenium. Selenium is not only a very good antioxidant, because what happens is that in the body, when the body is converting iodide to iodine, because the body needs iodine to make thyroid hormones, this process of conversion will form hydrogen peroxide. So it makes hydrogen peroxide, and hydrogen peroxide is a free radical, so it damages cells. Selenium helps to mop up the hydrogen peroxide, so it's fantastic for that. The other thing with selenium is that the conversion of T4 to T3 is selenium dependent. So it works on like two sides of the same coin in helping you in hypothyroidism and in hashis as well. Now, the other thing is low-dose naltrexone. Now, we don't actually know why low-dose naltrexone works, but in autoimmune conditions, it just helps the patient feel better, because with any autoimmune conditions, usually you just feel terrible. And low-dose naltrexone, because it's an opiate antagonist, it just helps to combat that chronic fatigue syndrome or the fibromyalgia and the aches and the pains that might go with it. But as to how it works, I can't answer how it works because we actually don't know. So what would happen is that a starting dose would be anything between 0.5 and 1 milligram, and it's slowly increased over a week or 2 weeks until about 4.5 milligram is reached, and then you just stay on a 4.5 milligram dosage, and you can stay on that indefinitely. Just interestingly, naltrexone is given to alcoholics to help them get off alcohol, because what happens is that the opioid, because it's an opioid blocker, it stops that sense of pleasure and high that you get with alcohol. So the pleasure of drinking alcohol slowly dissipates if you're on full strength naltrexone. And that's just a little aside. If you know somebody who's really, really struggling with alcoholism, and then they the AA is not working for them, then full strength naltrexone might be an option for them. All right, so with Graves is slightly different to hashis. They're both autoimmune conditions, and they both can be treated as a foundation. You treat the autoimmune condition. But where Hashimoto's manifests as an underactive thyroid, Graves manifests as an overactive thyroid. And it is less common than hashis, but the confirmation of the diagnosis needs, what they generally do is that they inject radioactive iodine, and then they have a look to see what's going on with the radioactive iodine in the thyroid. The problem to bear in mind, and that's why if one has signs and symptoms of Graves, which I'm going to go through now, I wouldn't rush to a specialist as the first line to treat it, because when they inject radioactive of iodine into the thyroid, it is going to destroy the thyroid. Now, of course, that's the reason that they do it, is because they want to destroy the thyroid, because the theory is if you have less thyroid gland, you're going to produce less thyroid hormones. But what it does do is that it damages the thyroid gland, and of course, it's going to kick you into a hypothyroid manifestation, and then you need to treat the hypothyroidism. So if one can do first line, treat the autoimmune condition first line, and then start looking at specific treatment in terms of any radioactivity. The other thing with radioactivity is that, one obviously needs to stay away from people, because if they've injected you with anything radioactive, you need to stay away from children or grandchildren, or even, people in the household. You've got to be very careful to rinse what you use and wash bedding and all of those a lot more carefully if you're being treated with radioactive iodine. So the symptoms of hypothyroidism, it's exactly the opposite of hypothyroidism. So you're looking at your heart rate going up, you get palpitations, sweating, a lot of anxiety, you might lose a lot of weight, diarrhea, because everything's working at a much faster pace. Where hypothyroidism, it's working at a slower pace. With hypothyroidism, everything's working that much faster. Fatigue, that happens with both actually, and you get trembling hands. You could get a goiter, because what happens is the thyroid starts to try and compensate, so it just gets bigger. So you could actually get a goiter, and in actual fact, if one has a look at oneself, and you slide your fingers down on either side of your esophagus, and you slide your fingers down, you should not be able to feel your thyroid. You shouldn't feel any lumps or bumps. So one can actually just check that and see whether or not there are any lumps or bumps on either side of your esophagus. So just in conclusion, not addressing the thyroid, any thyroid malfunction not only affects how good we feel, but it also affects our risk of heart disease, our risks of developing metabolic syndrome and obesity, and it also plays a role in whether or not we are at risk for Alzheimer's and even cancers. So all of these, to go back to the suggestion that every 5 years, especially with women, because we're much more prone to it, every 5 years, you have your antibodies checked. And then if everything's clear, you can tick that off the list. Then if you do have low thyroid symptoms, then you're addressing, usually it's a nutritional problem, you're addressing that specifically, and it's not an autoimmune condition. And it's great if one can be certain that you don't have any underlying autoimmune conditions. So just a couple of the questions that came in that I just want to address. I'm going to go through these ones first, Jess, and then we'll see whether or not anybody's got questions from the audience. But
perfect, thanks, Jules.
So one of the questions, what's the biggest trigger to cause hypothyroidism to become Hashimoto's disease? Now, although there is an overlap, generally the trigger is different. So the trigger for hypothyroidism is usually a problem between the conversion of T4 to T3, or the conversion of T4 to reverse T3, which is usually triggered by stress. And it might be nutritional deficiency. So when you're dealing with sort of like a pure hypothyroidism, those would be the things that we address. The Hashi trigger is different. The Hashi trigger is, because it's an autoimmune condition, the question you ask yourself is, what has caused the autoimmune condition or the autoimmune system to overreact? And then one has to look at that intestinal permeability issue or the genes. If one can do a gene profile test, then you need to look at those as a cause. So I think unless there are functional deficits in the hypothyroidism condition, hypothyroidism won't necessarily become Hashimoto's. So it doesn't, if you've got hypothyroidism, you don't have to think, am I going to get hashis? But I do want to mention that autoimmune conditions are on the rise, and especially with women. They're getting more and more and more prevalent. So if one is already struggling with one of the autoimmune conditions, then it's definitely worth having a look to see whether or not, even if you've got hypothyroidism, whether or not you've got a concurrent Hashimoto's. So the other one, is there a link between Hashimoto's disease and iodine deficiency? So iodine, there's a very complex interplay, because low iodine plays a role in hypothyroidism. And in hashis, if you are looking at iodine in hashis, you have to be very careful when you're giving iodine, because iodine plays a role in the development of TPO, so thyroid peroxidase. And if you give a lot of iodine because you suspect that the patient is low in iodine, which they might well be, then it can trigger more TPO. And with more TPO, there'll be, the immune complexes have got more TPO to fight, so then you can get a flare. So there is an interplay, but the focus on iodine is slightly different between Hashimoto's and the normal iodine deficiency that might come with hypothyroidism. So can hypothyroidism normalize on its own? Well, not if you carry on doing the things that gave you the hypothyroidism in the first place. So if you think that as far as your life is concerned, you've got certain habits, and your certain habits are leading you to have nutritional deficiencies or leaky gut syndrome or any of those problems, and you carry on, for example, we spoke about alcohol, and you carry on drinking lots of alcohol, which causes increase in intestinal permeability, and you don't change the problems that led you to this in the first place, then it's definitely not going to normalize. But if the question is, can it normalize without going on medication? Then the answer to that is yes, with different care. Hashis, it's going to depend on how much damage has been done to the thyroid before you start addressing the autoimmune condition. So now, one of the questions was, if I had Hashimoto's that turned into cancer, had your thyroid removed, can I suffer from Hashi symptoms? Yes, definitely. And hypothyroidism symptoms, you can definitely suffer from this. So even with no thyroid, you can definitely suffer from Hashi symptoms. And the ways to relieve them, what I would suggest, well, we've addressed a few of them now, but I would also suggest that the person who sent through this question, you just have a little look too at the part 1 of the thyroid discussion, and you might also just get some ideas on how to address this. Does anybody have any live questions at the moment?
Hi, Jules. So we've got 2 questions here. The first one is, do you have experience with, and I hope I say this correctly, lichen planus and Hashimoto's?
I actually don't, unfortunately. Yes,
okay.
It comes under the sort of the parasite heading, the parasite triggers, but I've never treated a patient with that combination myself.
Okay.
Sorry about that.
All right, no problem. No problem. And then the next one says, I was diagnosed with hypothyroidism and Hashimoto's
sorry, you just faded out. Can you repeat the question?
Okay, no problem. I was diagnosed with hypothyroidism and Hashimoto's disease when I was 12. I've been on naltrexone ever since I was 12, and I'm now 25. I got diagnosed with thyroid cancer earlier this year and had a partial thyroidectomy in May. Would changing my diet to gluten-free increase my chances of being in remission for hashis?
Definitely, without a shadow of a doubt. If you've not gone off gluten, I would say just as a start to really give your body the best chance to cool that inflammatory response, I would go off gluten.
Okay, thank you. And does Hashimoto's and the removal of your thyroid have an impact on fertility?
Now that's a brilliant question because health thyroid definitely does impact on fertility. So if one looks at it from that side, then yes, I would say that it probably does affect whether or not, the ease of falling pregnant. So the answer, I would say yes to that.
Okay.
Sorry, we also.
Is there any advice you can possibly give?
The only thing that I would suggest is to go all the way back to the beginning and start addressing, in other words, instead of addressing the fertility issue, I would address the thyroid issue. So I would go all the way back to the beginning and I would do everything that you can to cool the immune response and to improve the thyroid function.
Great, thanks, Jules. Does anybody else have any questions?
Just one that last question that came in that you emailed me, Jess, the one on COVID.
Yes.
It was an interesting question, and what I would say almost, and I'm sort of applying what I hope is common sense here. If people have an autoimmune condition, what happens is that their immune system is on high alert. So I would love it if they could do some type of epidemiological study and see whether or not, what is the incidence of COVID infections in people who have autoimmune conditions, because I would say it's probably less than in somebody who doesn't have an autoimmune condition, simply because with an autoimmune condition, the immune system is on high alert. And if your immune system is on high alert, it's going to be more effective at addressing the whole COVID sensitivity. But I'm guessing, I'm applying what I hope is reasonable logic. I would love all of those questions to come out somewhere in the wash, somewhere down the line.
Hopefully they will. Hey, just to keep everybody else in the loop there, the question was, does COVID-19 have an effect on Hashimoto's? So that's the question that Jules just answered. Anything else? All good. Well, Jules, thank you so much. Hi, Jules, with regards to COVID and Hashimoto's, I had COVID and had no side effects of COVID.
Oh, fantastic. Okay, good. Well, we should gather that information. I think it would be lovely to see whether or not other people have had that same experience.
Yes, definitely. And to continue, my thyroid levels were actually better than with no COVID.
Okay, that is extremely interesting.
So maybe you are onto something there.
I'll post it on Facebook.
Awesome. Well, if there's nothing else, Jules, again, thank you so much from our side, again, for your many, many, many years of wisdom and knowledge. It's always so great to listen to you and see your passion and to learn from you. And I know that it takes a lot of preparation and a little bit of technological stress.
I'm so sorry about that. No, I'm sorry about this. Don't worry.
No, yeah, we're sorry about that and all the added stress.
Next time I'll just start a whole lot earlier.
I think your computer needs to see a functional doctor.
My computer needs to see it.
But thank you so much. And thank you so much to everybody else that has joined us and for your questions and prior to tonight as well as tonight, and for giving of your time and for joining us. And we hope to see you all soon.
Wonderful. Thank you so much, Jess. I loved it. And
Thanks,
thank you very
everybody.
much.
Thank you
Have a
so
lovely
much,
evening.
Jules. Amazing.
Thanks so
Thanks,
much.
everyone.
Enjoy your
Thank
evening.
you. You too.
Bye.
Bye.